Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, clinical features of amoebic liver abscess. So, if you see clinical features of amoebic liver abscess, a patient with amoebic liver abscess, he most commonly presents with abdominal pain. Most common symptom is abdominal pain, followed by the patient here in amoebic liver abscess. Actually, in amoebic liver abscess, the patient will be around 20 to 40 years of age with history of travel to an endemic area. The patient will have history of travel to the endemic area, following which the patient develops fever with chills and rigors. The patient develops fever with chills and rigors, and he also develops the anorexia. Abdominal pain is also seen, especially in the right upper quadrant. Pain is seen in these patients. A recent history of diarrhea is generally uncommon in a patient with amoebic liver abscess. Then, active colitis and amoebic liver abscess rarely occurs simultaneously. These active colitis and amoebic liver abscess rarely occur simultaneously. If there are any colonic lesions, they will be silent, and the amoebic liver abscess is the one which mainly presents in the entamoeba histolytica infection. Jaundice in amoebic liver abscess is very rare, whereas in pyogenic liver abscess, jaundice is more common. Raised prothrombin time is the most common liver function test abnormality in amoebic liver abscess, whereas raised alkaline phosphatase levels are the main important features in pyogenic liver abscess. Now, diagnosis of amoebic liver abscess. So, in the diagnosis of amoebic liver abscess, a patient with amoebic liver abscess, we should do an ultrasonography and the CT scan are the main modalities of diagnosis in amoebic liver abscess. The diagnosis is mainly confirmed by the serological test. That is, for the diagnosis, we do an ELISA is done with an anti-amoebic antibodies. For anti-amoebic antibodies, serological tests or ELISA are done for amoebic liver abscess, and cultures of amoebic liver abscess, if you do, they are most of the cases they are sterile or negative cultures are seen in amoebic liver abscess. If you do a chest x-ray, on the chest x-ray you will see that there is elevated hemidiaphragm. So if you do a chest x-ray, you will see that there is elevated hemidiaphragm is seen. Why? Because this is the liver, there is an abscess here. So obviously, because of the abscess, the pressure exerted by the abscess, the hemidiaphragm, this part of the diaphragm will be elevated. The right side of the diaphragm will be elevated, whereas the left side of the diaphragm will be normal. So on chest x-ray, elevated hemidiaphragm will be seen, and there is effusion of this fluid will occur into the pleural space, resulting in right sided pleural effusion. And if there is amoebic liver abscess, you will see presence of reddish brown on anchovy sauce pus is seen, which is the most characteristic feature of the um, actually the most characteristic feature of amoebic liver abscess is actually the color, than color. This reddish brown anchovy sauce paste like appearance will be present, but apart from color, odor of the fluid is also most important in amoebic liver abscess diagnosis.
thank you and thank you for watching.